Our correspondent Tariq Abu Azoum joining us from Deir el-Balah in central Gaza. So you're outside a hospital where people have been showing up starving and exhausted, Tariq. Are the hospitals able to help them?
Yeah, that's completely right, Doreen. The Gaza's barely functional hospitals, including Al-Aqsa Hospital, has received in the past few hours a relative surge in the number and influx of patients who are suffering from severe malnutrition with visible signs of exhaustion being pretty much clear over their faces and over their bodies. The hospital, as we understand, is under-resourced and operating without enough resources. And we have been sharing thoughts and discussion with medical teams on the ground here who have been operating beyond the official capacity, saying that what is unfolding is a slow-motion famine that started to take place across the entire Gaza Strip, where children, elderly people and women have been delivered to Al-Aqsa Hospital in order to receive urgent medical treatment. And for better explanation about this, I'm joined right now by Dr. Khaleel al-Deqran. He is the spokesperson of Al-Aqsa Hospital.
Thank you for your time and thank you for talking to us. The health ministry stated that there is a surge in the number of children and individuals suffering from malnutrition. Keep us updated with the massive influx of patients with malnutrition. That's true. The stages of malnutrition and undernourishment has reached rock bottom. The number of victims to the policy of hunger and starvation adopted by the Israeli occupation forces have increased, encompassing all ages. All the patients are suffering from skin infection, fatigue, pale skins. Apart from the other victims, the majority of those victims are starved to death. The Israeli occupation forces allege that they are handing out aid, yet these food distribution centers are nothing but death traps. Rather than serving or handing out relief aid to the Palestinians, they are adding to their suffering. This aid is soaked in blood. Even those people were able to reach these food distribution centers are coming back either empty-handed, killed, or wounded. The number of victims at these food distribution centers has exceeded more than 850 who were killed, in addition to other thousands of young men and children who suffered severe injuries. Despite all that, the Israeli occupation forces continues to deny the delivery of fuel to hospitals. This is a systematic policy of starvations. As I said, the number of patients suffering from malnutrition has increased many-fold, not only in this hospital, but throughout all medical centers within Gaza Strip. We are not even able to provide a single meal, not to the victims or patients, but also to the working staff. The living conditions have reached rock bottom. It is beyond recognition. This is a 5-stage famine, which is the worst according to the classification of the World Health Organization. That's why the international community must act now and without any delay. Otherwise, it is a green light for the occupation forces to continue with these policies. Medically speaking, how can you as a staff are able to cope, and how do you address the symptoms of malnutrition considering these dire conditions on the ground? It is really dire. It is catastrophic. Many of those patients have lost their lives simply due to the total absence of nutrients. Many of the children have lost their lives as a result of undernourishment. Even baby milk is absent. In addition to that, infectious diseases have spread. Large numbers of children have come to the hospital, first of all, if not injured by the Israeli ruthless bombardment, they are suffering severe malnutrition. Even those survivors are living within the ruins of their destroyed homes amid unhealthy conditions, total absence of hygiene. As a result, their immunity system have been deeply impacted. Now, many serious diseases have broken out. The meningitis and other serious diseases have broken out among all the Palestinians within Gaza Strip, namely children, amid total absence of medicines, medical resources, food, and clean water. The whole world must act now to salvage what is left of Gaza Strip. More than 560,000 children are in dire need for food, 60,000 of them having their lives hanging by a thread.
Testimony that has been shared by the Dr. Khaleel al-Deqran, and it reflects the grim reality unfolding across Gaza's hospital and to which level the humanitarian situation has been extremely deteriorating. Deir.
Thank you so much, Tariq Abu Azzoum, for that reporting from Gaza.
Make sure to subscribe to our channel to get the latest news from Al Jazeera.